Okay, ma'am, I got.
All right. So if you've read and understood, considering its surgical pathology station, please tell me what are the differential diagnoses you'll consider for this patient?
Okay, this patient may have the carcinoma of the esophagus, eclasia cardia, or motility disorder, or corrosive stricture.
Okay. Right. What might be the risk factors which are contributing to this condition?
For this patient, I consider the smoking, um, uh, smoking, then the JAT, and it also includes the alcohol or obesity,
All right.
other cause.
Okay. Uh, can you tell me what is GERD stands for and how does it contribute to
Okay,
this
ma'am. Yeah.
condition?
Okay, ma'am. In case of JAT, there will be the regurgitation of the acid, then irritation of the mucosa, and there will be the metaplasia of columnar epithelium from the stratified squamous epithelium. There
All
will be adenocarcinoma.
Okay. What do you think might have contributed to the weight loss, unintentional weight loss of the patient?
Yes, patient cannot take food due to the regurgitation and the pain,
Okay. Right.
and there will be vomiting.
All right. And there is progressive dysphagia as well. Can you
Yes.
help me understand what might have caused that?
The the growth gradually increase. That's why the progressive display occurs, and the foot also gives the pressure over the tumor.
Okay. What was the provisional diagnosis you'll consider you mentioned?
Eclasia cardia, ma'am.
Okay. Why would you
Oh, sorry. For
consider
this patient, yes, provisional diagnosis carcinoma of the esophagus,
esophagus? Okay. What is the most common carcinoma of the esophagus?
squamous cell carcinoma, then
All right.
adenocarcinoma.
And this squamous cell carcinoma occurs in which part?
Yes, in the proximal two-third of the esophagus, and lower one-third is the adenocarcinoma.
All right. Okay. What management can be okay? What investigations would you do
Okay, ma'am.
to
I'll do
confirm your
the
diagnosis?
upper GI endoscopy and biopsy, and also I can do the barium swallow of the esophagus, CT scan of the chest, and endoluminal ultrasound, a PET CT.
Yes. And what treatment can you offer
Okay,
to the patient?
treatment depends upon the site of involvement,
Yes.
patient physical condition, and the metastasis. Two types of treatment. One is curative intention and another is palliative. Curative includes the surgery, here the endoscopic mucosal resection, total esophagectomy, then chemoradiotherapy, and palliative option, surgical resection and external beam radiotherapy, stenting, brachytherapy, cryotherapy, alcohol injection.
Okay. Right. You've told me most of the questions you've answered already. Okay. How, right. What treatment, you've told me the management. Okay. Right. Please tell me how would you classify the carcinoma of esophagus?
Yes, there is several types of carcinoma like the squamous cell carcinoma, adenocarcinoma, and the others like some small cell carcinoma, choriocarcinoma, sarcoma, leiomyosarcoma.
Yes, what I wanted to know that the treatment
But
that is offered, TNM classification
yes, I know,
and
ma'am. Yes,
histological classification.
yes,
These are the
history.
two.
Yes,
So if you could explain both of these for me.
yes, yes, ma'am. Can I say the TNM classification, ma'am?
Yes, first, and then please tell
Yes,
me the histological classification as well, considering that this is the pathology station.
yes. T1, TIS, the high grade dysplasia, and
Ye-
T1
Yes.
is the invasion in the lamina propria, muscularis mucosa, and submucosa. T2
Yes.
invades the muscularis propria. T3 invades the adventitia. T4 again T4A, T4B. T4A invasion of the resectable surrounding structure like the pleura, pericardium, and diaphragm. And T4b is the involvement of the unresectable structure like vertebral body, trachea, bronchus. And N here the N0 no lymph node, N1 1 to 2 involved lymph node, and 2 is the 3 to 6 involved lymph node,
Yes.
and
And
P3 is the N3 is the more than 6 lymph node, positive lymph node.
yes, 7 or
And the M0 is no metastasis, M1 is the distance
different.
metastasis.
Good.
And the histological G1, grade 1 is all differentiate, grade 2 is the moderately differentiate, grade 3 is the poorly differentiate,
Good.
and grade 4 is the undifferentiate.
Right. Good. Right. You have told me, yes, all the questions, yes, has been answered very quickly. Right. What is the obtained cells for the biopsy? Like once you obtain the biopsy, what are the two things you look for?
Yes, ma'am. I'll look for the grading and
Yes.
the immunohistochemistry.
All right. Good. And okay. Once you are doing the biopsy, for immunohistochemistry, what is the stain that can be used most
Yes,
commonly?
it's the cytokeratin, ma'am.
Okay, please tell me, in case if the result comes back and it shows that patient has Barrett's esophagus instead, what would be the pathogenesis behind it?
Yes, in case of the Barrett's esophagus, there is the loss of ganglion cell in the mesenteric plexus.
Yes, and there'll be what kind of epithelium?
Yes, it's the columnar epithelium.
Yes, of the stratified squamous
Yes.
type. Right. Okay, what more I can ask you? Right. If this same patient develops pleural effusion after you've done all the management that you thought of, what would be the possible cause behind it?
Okay, ma'am. At first, I'll do the effusion fluid cytology, and the treatment includes the thoracosynthesis, pleurodysy, and indwelling pleural catheterization, and pleuroperitoneal shunting.
Yes, you told me the treatment, but what would be the condition that you'll consider? What would be your provisional diagnosis? Why patient has
It's the
pleural effusion
metastasis.
now? Yes, okay. There could be spread. So
Yes,
it's,
ma'am.
yes, there could even be spread to lungs, or
Lungs,
there could be obstruction of the
obstruct the
thoracic duct.
bronchus. Yes,
Yes,
thoracic duct. Thoracic duct.
right. So you'll go for the palliative treatments, and you've
Yes,
already
ma'am.
told me. Okay. Right. After a while, the same patient visits you, and patient has developed enlarged supraclavicular lymph node. What investigations would you ask for?
Okay, ma'am. I'll do the fine needle aspiration cytology from the lymph node.
Yes. And what features would you expect to see in this fine needle aspiration?
Yes, high mitotic index,
Yes.
and the I
Cells would have hyperchromatic
yes, ma'am. I can say
sepia. Yes.
hyperchromatic eccentric nucleus with the intercytoplasm in
Vacuolation.
vacuoles, vacuolation.
Okay. Right. There could also be one terminology, or what are the okay, one terminology that is used. It's what is troponin?
Yes, troponin is a complex of three regulating protein that control the muscle contraction. It has troponin I, S, and T.
Good. Thank you.
Thank you, ma'am.